whether to delegate this responsibility to the Department of Defense, because dealing with Ebola warrants a military medical approach rather than a bureaucratic political Washington approach. And joining us now, Dr. Frank Esper, who is the infectious disease specialist at University Hospital's Case Medical Center in Cleveland. Thank you for joining us, Dr. Esper.
It's good to be here, Heather.
So let's begin there. Should the head of the CDC step down?
You know, certainly the CDC has had a lot of problems, especially at the beginning of the year when they're talking about the problems that they had with the anthrax in their research facilities as well as in the smallpox. However, when it comes to the CDC's response to the Ebola, it came very quickly. It has been, especially from a physician's standpoint, for people who are ready to take care of individuals, it has been spot on up to this point. We certainly know that healthcare workers and their close families are at risk of getting this virus transmitted to them. We understand this risk, and we do everything that we can to prevent that risk, but nothing in life is ever 100%. We have been watching all the people who have been in contact with Mr. Duncan down in Texas very closely. The CDC has been all over that, and this is one of the reasons why this individual knew to look for symptoms and to present to healthcare authorities when they develop symptoms without exposing a lot of other people.
But here's the thing, this individual, this nurse, was not included in the original 48 that the CDC was monitoring, who they say came into contact with Duncan, who later died. But now they're saying that this person who was not included in that list, quote, had extensive contact with Duncan on multiple occasions. Yeah. So why was she not included in that list?
Well, I'm not able to say exactly which list the people were included in. The initial contacts that they were looking for were the people who this individual could have been exposed to before they presented to the hospital, or especially when he was accidentally and unfortunately sent home the first time that he presented to the hospital. Those were the initial 50 people that they were looking for, the very close contacts for the people within that apartment building, as well as the people that he had seen in the emergency department the first time. The second round, after he unfortunately succumbed to his illness, those healthcare workers already knew what their exposures were and knew what to look out for, because we have a lot of guidance from the CDC of what symptoms that we should watch out for, how long we should watch for them, and who we should call if we do develop those symptoms.
Now, a lot of guidance, but for some, not nearly enough. The National Nurses United Union, for instance, they said that 85% of nurses that they surveyed said that they've not been provided any education. So how confident should nurses that you work with, other practitioners, be when they're going into situations like this?
You know, the answer is that every nurse should not be, or every nurse should be aware of the risks. However, every hospital, through the guidance of the Centers for Disease Control, is actually right now understanding that there should not be, this isn't someone that should just be received and cared for by any nurse. We are now in the process of identifying, at least at this hospital, we are identifying specific teams that will say, if we ever do, and we certainly hope we do not, but if we do see an Ebola case or a patient that we need to rule out Ebola, only certain senior medical staff, only certain senior nursing and technicians have already been identified, have already gone through training of how to put on and take off their protective equipment, where these people will need to go. Every hospital and every institution is in the process of putting those kinds of guidelines together so that we don't get the trainees who are much more likely to make a mistake. I have a feeling that, unfortunately, the person who did get infected with Ebola was probably one of the very senior individuals at that institution. However, this is a risk that we as healthcare providers have for this disease as well as every other infectious disease.
And we're not placing blame on the victim now, either the nurse that has become infected. Thank you so much for joining us, Dr. Esper. We appreciate it, and we, of course, wait for that new comment from the CDC, a news conference expected at noon. Thank you.
Well, and Heather, for more on the political impact of the Ebola response,